Good morning, everyone, and welcome to our group presentation. As you can see, our group members are Gabriel Hamilton, Dominique Mattis, Brianna Jackson, Amelia Ebanks, Ashani Green, Celian Marson, and Anastasia Forrester. And today we will be educating you on hypertrophic cardiomyopathy. So hypertrophic cardiomyopathy can be defined as a type of heart disease that affects the heart muscle, namely the myocardium. It causes thickening of the heart muscle, especially in the ventricles or the lower heart chambers. Here we also have some images that display the thickening that happens in the myocardium. There are mainly two types of hypertrophic cardiomyopathy. They are obstructive and non-obstructive. This disease, it is important to note, is often the result of genetic malformation of the sarcomeric contractile protein. Okay, so our obstructive hypertrophic cardiomyopathy. This is a thickening of the wall between the left and right ventricle, which prevents blood from flowing freely from the heart to the body. Therefore, it is called obstructive as it obstructs the flow of blood. For non-obstructive hypertrophic cardiomyopathy, the left ventricle is thickened, which impairs the ventricle from its pumping action. Although the flow of blood is not obstructed, the effect on the cardiac function is the same, and inadequate volume of blood is pumped from the heart to the body. As you can see, we have pictures that show the difference between the obstructive and the non-obstructive.
Hypertrophic cardiomyopathy is normally treated through lifestyle changes, the use of medications, and surgery. Healthy lifestyle changes are crucial to managing hypertrophic cardiomyopathy. Such lifestyle is consumption of sodium and fatty foods, limiting alcohol consumption, and cessation of smoking. Medications available for treatment of cardiomyopathy include beta blockers. These medications decrease the heart rate by blocking the hormone adrenaline. With the heart rate decreased, the heart pumps slower and fills up more efficiently, therefore decreasing the workload of the heart. Some beta blockers used to treat hypertrophic cardiomyopathy are propranolol, atenolol, and metoprolol. Calcium channel blockers. These medications work by blocking calcium from entering cells, resulting in dilation of the arteries, which allows the heart to fill more efficiently. These drugs improve symptoms of hypertrophic cardiomyopathy, such as tachycardia, by slowing the electrical impulse conduction at the sinoatrial and atrioventricular nodes. Verapamil and diltiazem are calcium channel blockers used to treat hypertrophic cardiomyopathy. Anticoagulant medications. Medications such as warfarin and dabigatran are used in the treatment of hypertrophic cardiomyopathy as a preventative measure for blood clots. Surgical options available for the treatment of hypertrophic cardiomyopathy include septal myectomy. This is a surgical procedure done if medication fails to alleviate the symptoms of hypertrophic cardiomyopathy. It is an open heart procedure that involves removing a part of the thickened septum between the ventricles, resulting in easier emptying of the ventricle. Septal ablation. This is a non-invasive procedure where a doctor will use a catheter to insert alcohol into the area that is thickened. The toxic nature of the alcohol used will cause the heart muscles to shrink and die, therefore reducing the overall heart thickness. An implantable cardioverter defibrillator is a device that is placed in the chest and is used to monitor and stop abnormal heartbeat. If the heartbeat is abnormal, the ICD would deliver calibrated electric shocks until the heartbeat becomes normalized. Hypertrophic cardiomyopathy most often goes undetected by people as it has few, if any, signs of symptoms. The affected individual can lead a normal life with no significant problems before being diagnosed with the condition. Son displayed no signs of this condition, hence there was oblivious to the condition.
For the needs, for the care plan, there are three needs. Number one, oxygen. Number two, rest, comfort, and activity. Number three, safety and security. For the assessment, subjective data. Patient reported chest pain, feeling extremely tired and lightheadedness. Patient also reported having shortness of breath when lying down or doing activities, as well as not passing enough urine. For the objective data, distension of the jugular vein noted. Crackles heard upon auscultation over the lung. For the objective data, distension of the jugular vein noted. Crackles heard upon auscultation over the lungs. S3 auscultated over the pericardium. Edema noted to both feet, the same pitting 3+. Patient appears to be restless and anxious. Temperature 97 degrees Fahrenheit. Respiratory rate 28 breaths per minute. Oxygen saturation 89% on room air. Pulse rate 110. Blood pressure 140/90.
Diagnosis: decreased cardiac output related to structural changes of the heart muscles, as evident by the patient reported chest pain, feeling extremely tired and lightheaded. Patient also reported having shortness of breath when lying down or doing activities, as well as not passing enough urine. Distension of the jugular vein noted. Crackles heard upon auscultation of the lungs. S3 auscultated over the pericardium. Edema noted to both feet, same, pitting 3+. Patient appears to be restless and anxious. Temperature 97 degrees. Respiratory rate 28 breaths per minute. Pulse rate 110 beats per minute. Blood pressure 140/90.
Patient's outcome. At the end of 2 hours of collaborative nursing intervention, patients will show signs of adequate cardiac output as evidenced by blood pressure, pulse rate, and rhythm within normal range for patients, strong peripheral pulses, and experience absence of chest pain, lightheadedness, and dyspnea during minimal exertion.
For the intervention, number one, monitor and give supplemental oxygen. Rationale: supplemental oxygen will reduce hypoxemia and improve oxygen saturation in the blood. Number two, assist the patient for semi-fallow or high fallow position. This will allow for greater chest expansion, which will improve lung capacity. Number three, administer medication as prescribed. Medications such as beta blockers and diuretics decrease the workload of the heart and improve cardiac efficiency. Number four, monitor fluid input and output. Rationale: imbalanced input and output may indicate decreased renal perfusion resulting from decreased cardiac output. Intervention number five, monitor the patient vital signs, especially the blood pressure, pulse rate, respiratory rate, heart and lung sounds, and peripheral pulses. Rationale: these may indicate improvement or deterioration such as impending cardiac failure and other complications. Intervention number 6. Encourage bed rest and limit physical activity. Rationale: this is to decrease oxygen and heart demand. Intervention number 7. Place the patient on a cardiac monitor. This is to monitor the electrical impulses of the heart and to detect any abnormalities. Number 8. Educate the patient about the condition, the medical management, and the importance of maintaining a healthy lifestyle such as dietary changes. Intervention: rationale: educating the patient about the condition can lead to an increased positive health outcome and can help to reduce anxiety and restlessness, such as a diet in low sodium and a diet in low sodium reduces fluid. Intervention number 9. Refer the patient to a cardiac center. Retention and decreased workload on the heart. Intervention number 9. Refer the patient to cardiac centers or institutions. These institutions help people who are suffering from cardiomyopathy and other heart disease with emotional support.
Goal met. Within 2 hours of collaborative nursing intervention, patient displayed signs of adequate cardiac output as evidenced by blood pressure, pulse rate, and rhythm within normal range for patients, strong peripheral pulses, and experienced absence of chest pain, crackles, lightheadedness, and dyspnea during minimal exertion.
You have a thing called cardiomyopathy. When the heart muscle change its properties, there are many different types we can discuss. But let me tell you this first. Hypertrophic make the muscle get thick. Shortness of breath, ventricle them stiff. Obstructive is the more common type. Space in the left ventricle get tight. Non-obstructive has a different name, but the effects on the heart is the same. Beta blockers are a very good drug to keep the rhythm of your heart full of love. Electrocardiogram at the test measure heart activity at rest. Any irregularities it detect. Me say any irregularities it detect. Now you know about cardiomyopathy. You can pass the exam easily. Now you know about cardiomyopathy. You can pass the exam easily.